Initial Experience with Lucidis EDOF Lenses by Dr. Dennis Gong, Eye Specialist Center, Kuching. This talk is sponsored by SteriMedic. Lucidis is an advanced refractive EDOF lens designed to correct vision post-cataract surgery. It has a wide range of focus and has what the company called EDOF technology instant focus. There is little loss of light and decreased photopsia, closely mimicking a monofocal lens. The visual range extends from near continuously to distance visual acuity. The closed-loop design also enables stable fit in the capsular bag. The lens is designed with a center 1 mm aspheric zone for near and intermediate vision and a refractive zone for distance vision. Cross-section of the lens showing the center with an extended range of focus for near and intermediate vision and the peripheral part for distance vision. It is a single-piece hydrophilic acrylic lens of 6 mm optical diameter with an extended depth of focus, and the power range is from +5 to +30 diopters. Basically, the Lucidis lens come in two sizes, the 10.8 mm and the 12.4 mm. The 10.8 version is easier to handle as it is smaller, but if you are using the toric, it is advisable to use the 12.4 mm size to reduce the risk of rotation. This is a monocentric retrospective study of 50 patients implanted with Lucidis lenses bilaterally at Eye Specialist Center, Kuching. Patients with concomitant eye diseases were excluded from the study. Pre-operative visual acuity, NIDAC AL scan, IOL master, air path tonometry, and OCT of the macula were done routinely. Surgery was done routinely on the temporal position, but when indicated on the steepest corneal axis and limber relaxing incisions as well, aiming to reduce astigmatism to less than 1 diopter. For astigmatism over 2 diopters, generally a Lucidis toric, the 124 MT, will be implanted. Target refraction was ametropia in the first eye, and the second eye adjusted slightly depending on the first eye refraction outcome. Follow-up was done at day 1, 1 week, 1 month, and 3 months post-operatively. Subjective refraction was done at least 1 month post-operation, and near, intermediate, and distance visual acuity were assessed. Patient-reported outcomes were also assessed subjectively. OVD is used to line the injector, and then the lens is taken from the container and put into the groove, making sure that both the optic and the haptic are stuck in securely. And then the lens is injected into the AC using a bimanual technique. The Parasinski hook is used to control and place the lens into the bag in one motion. Centration of the lens is done with a Sinski hook, and then OVD is removed from both anterior and posterior to the implant. The closed-loop haptic ensuring a well-centered implant. Altogether, there were 126 eyes of 63 patients. 23 of them were male and the rest 40 of them were female. The average age was 67 years old. Pre-operatively, the base corrected visual acuity for distance was around 20/40, and post-operatively, the mean uncorrected near visual acuity was about N4, intermediate uncorrected visual acuity about N6, and the distance uncorrected visual acuity about 20/30. Post-op at least 1 month refraction showing about 75% were within plus minus 0.5 diopter of emmetropia. Cumulative percentage of uncorrected near visual acuity showing 11% can achieve N3, 63% can achieve N4 or better, 81% can achieve N5 or better, and 94% can achieve N6 or better. Cumulative percentage of uncorrected distance visual acuity in blue and corrected distance visual acuity in brown color. Cumulative percentage of uncorrected distance visual acuity showing 18% can achieve 20/20, 47% can achieve 20/25 or better, 68% can achieve 20/32 or better, and 82% can achieve 20/40 or better. Cumulative percentage of corrected distance visual acuity showing 34% can achieve 20/20, 94% can achieve 20/25 or better, 98% can achieve 20/32 or better, and 100% can achieve 20/40 or better. Further analysis of the poorer uncorrected distance visual acuity showed that they were mostly due to a myopic shift in the target refraction. That is, the actual refraction was more myopic than the target refraction. This is a rather busy slide showing patient-reported outcome of Lucidis EDOF lenses. Number 1, grading satisfaction of the lens showed that 96% of patients were at least moderately satisfied with the Lucidis lens, and only 4% of patients were unsatisfied. Question number 2 about optical correction for distance and near activities showed that 94% only occasionally or never need glasses for both near and distance activities. Question number 3 about optical correction for distance activities showed that 94% only occasionally or never need glasses for distance activities. Question number 4 about optical correction for near activities showed that only 92% only occasionally or never need glasses for near vision. Question number 5 about optical correction for computer activities showed that 96% of patients never need glasses for computer activities. Question number 6 about dysphotic phenomena affecting activities showed that 85% are never affected at all, and only about 15% are sometimes affected by dysphotoptic phenomena. In conclusion, Lucidis EDOF lenses perform well for near, intermediate, and distance vision with little dysphotopsia or glare and halo issues. Uncorrected distance visual acuity can be affected by actual refraction being more myopic than the intended target refraction. Thank you very much for watching.